Encompass Health is a national leader in post-acute care. We're committed to creating a seamless system where high-quality, cost-effective care is coordinated by clinical teams across the inpatient and home settings. Each time a patient enters our care, our goal is to return him or her to maximum function and a quality life. Patients who come to our inpatient rehabilitation hospitals have significant physical and cognitive disabilities or injuries due to medical conditions such as strokes, hip fractures, and a variety of other debilitating conditions. Encompass Health hospitals are outfitted with the most advanced technologies and employ cutting-edge therapeutic methods. Our home-based services include skilled nursing, physical, occupational, and speech therapy, medical social work, home health aid services, and hospice services. Through this video, you will experience Encompass Health's innovative approach to connected care as we follow the patient journey to superior outcomes.
An Encompass Health patient's journey begins when they experience an event that causes significant physical or cognitive impairment. At the onset of illness or injury, the patient will likely go to an acute care hospital to receive emergency care and life-saving treatment. When the acute care team recognizes post-acute care is needed, the case manager and physician will discuss options with the patient and their family that could include continuing treatment at an inpatient rehabilitation hospital. At this point, an Encompass Health liaison performs a pre-admission assessment and meets with the patient and their family to answer questions and explain why Encompass Health is the post-acute provider of choice. Differentiating factors that position Encompass Health as an industry leader include leading-edge rehabilitation expertise, including independent rehabilitation physicians, an emphasis on specialized rehabilitation nurse training, specialized physical, occupational, and speech therapists, state-of-the-art therapy gyms and rehabilitation technology, disease-specific certifications through the Joint Commission, use of a rehabilitation-specific clinical information system that can connect with the acute care hospital and other providers to allow for the seamless exchange of patient information, use of data analytics captured within the clinical information system to provide better care, and clinical collaboration with our home health segment to ensure safe patient transition upon discharge to home. If the patient chooses an Encompass Health hospital as their inpatient rehabilitation care provider, the patient's physician signs the referral order and our team begins the admission process. We work directly with the acute care hospital to facilitate a seamless transition into rehabilitative care. This includes connecting our rehabilitation-specific electronic clinical information system, known as ACIT, to the pre-admission assessment process, resulting in an electronic exchange of the patient's information with our systems. By electronically connecting the pre-admission process for liaisons and rehabilitation physicians, we streamline our operational processes to ensure our hospital is prepared for the patient's arrival. We've designed our 40 to 50 bed prototype hospitals with efficiency, accessibility, and safety in mind. Our hospital's one-story design helps with transporting patients to the different treatment and non-treatment areas of the hospital. Our prototype hospitals include all private rooms with the core infrastructure of the building constructed with future expansion in mind. As the patient enters our hospital, our team begins developing the patient's individualized care plan. The care team will conduct functional and, if needed, cognitive assessments over the next 3 days, and by day 4, the care plan is agreed upon by all members of the team, including the rehabilitation physician. Communication is key to our multidisciplinary approach to care. A patient's rehabilitation team includes a case manager, a rehabilitation physician, and other attending physicians, nurses, a dietitian, and physical, occupational, and if necessary, speech therapists. Regular team huddles are held to discuss the patient's progress towards their goals and make any necessary changes to the care plan. Patients are seen by a physician as often as needed, including a visit 3 times per week by a physician with specialized expertise in rehabilitative medicine. In addition, patients are sometimes seen by other physicians as needed for medical co-management. Patients at Encompass Health hospitals receive 24-hour, 7 days per week registered nursing care. In addition, Encompass Health hospitals encourage its nurses to earn the Certified Rehabilitation Registered Nurse distinction. This prestigious certification documents the highest level of specialized knowledge in the rehabilitation nursing industry. Mobile nursing stations allow nurses to chart vitals, administer medications, and document additional notes at the patient's bedside. Patient rooms are spacious with wide doorways to accommodate wheelchairs or other equipment. Bathrooms have walk-in showers with no tub or lip to step over. Our hospitals also include specialty rooms to more comfortably accommodate patients of size. Our bariatric rooms include beds that can manage up to 1,000 pounds and feature lifts to keep the patient and employees safe. Isolation rooms are used to prevent cross-infection should a patient have an airborne infection. Isolation rooms feature vinyl flooring with chemically sealed seams, an anti-room with sink and HVAC system to maintain negative air and eliminate the spread of infectious diseases. The highlight of our inpatient rehabilitation hospitals and a patient's stay is a spacious therapy gym, where we use advanced therapies in conjunction with innovative technologies to get patients ready to return to the community. Patients spend at least 3 hours a day, 5 days a week in therapy. At Encompass Health, we're doing more than offering the latest rehabilitative technology. We're creating it. We developed the Auto Ambulator, a sophisticated treadmill device that uses bodyweight supported ambulation and robotics to help patients with gait disorders. It safely places patients in a standing position as robotics assist the patient's legs as they walk on a tread. Sensors continuously monitor walking patterns, changing power and speed according to the patient's mobility. Our hospitals also offer bodyweight supported treadmills to provide support to patients relearning to walk after a stroke or other illness or injury. Ceiling lifts are also used throughout our hospitals to hydraulically lift and transfer patients from their bed or wheelchair. The therapy gym lifts make it safer and quicker for our clinicians to assist patients and allow them to work through therapy tasks with confidence. Self-care and activities of daily living are practiced in the hospital's Activities of Daily Living Suite. This special area of the hospital is designed to promote patient independence for their return home and allows them to safely practice the skills needed for daily living, such as bathing, dressing, using the restroom, eating, preparing meals, and doing housework. Because this area is an important part of the patient's return to the community, it is used by all types of therapists. Physical, occupational, and speech therapists work together to allow the patient to practice memory and hand-eye coordination by asking them to retrieve grocery items from the refrigerator to make a sandwich, ask the patient to navigate the room and make the bed, or move to a cabinet and call out the items they see in it. Quiet therapy rooms are functional spaces for patients who have experienced a brain injury or need an area to focus on therapeutic tasks without the distraction of noise and activity in the therapy gym. This room can feature special technology, music, or lighting that improves motor control, cognitive learning, visual reaction time, and peripheral awareness. In our hospital's outdoor courtyards, patients can work with their assistive devices and a physical therapist to safely learn how to maneuver on a variety of terrains and obstacles. Speech therapy is offered for patients who need to improve their ability to swallow, or speak, or improve a patient's cognition. Technologies like the Vital Stim can be incorporated to enhance therapy and produce results quicker. The Vital Stim is an innovative technology that electrically stimulates swallow functions. Through specifically designed electrodes attached to the patient's neck, a small current stimulates motor nerves, causing the muscles in the neck to contract for improved swallowing. Repeated therapy using the Vital Stim helps to gradually retrain the muscle group to complete the swallowing process. Our on-site pharmacies oversee medication management for our patients while under our care. Our pharmacists play a vital role on the care team. Through medication management, reconciliation, and education is part of the patient's admission and discharge process. ACE-IT allows all of these clinical practices discussed to be streamlined by integrating the patient's medical record for the entire episode of care and across the multidisciplinary team. Clinical notes from the physician, nurses, therapists, and case manager can all be shared in real time to assist with care and discharge planning. In addition, quality reporting, hospital census, patient billing, and other administrative functions can be performed using data from the system. At Encompass Health, our clinical information system enhances patient safety and outcomes through use of predictive analytics, automated drug, allergy, and other contraindication alerts, computerized physician order entry, barcoded point-of-care medication administration, decreased loss of paperwork, and secured access to patient records at any time and at any place. Our clinical teams share the same goal as our hospital patients, returning them to their community where they can enjoy the highest quality of life. The transition to home can be a high-risk time for patients as they may continue to have impairments and limitations that require additional care. Encompass Health offers home-based services in the majority of our markets. This clinical collaboration between our two operating segments allows us to effectively transition patients home while ensuring the continuation of their care plan to maximize the patient's abilities to function in the community. Working together as a coordinated team, Encompass Health has dedicated care transition coordinators that work with the patients who choose our home health services. To ensure a seamless transition home, care transition coordinators begin meetings with the patient and their family early in their inpatient rehabilitation journey. Like our hospitals, our home health agencies maximize the use of technologies to drive high-quality outcomes. Our home care, home-based platform ensures every clinician has the latest patient information and clinical best practice data at their fingertips. We employ a group of specially trained clinical staff who provide oversight and care coordination to high-risk patients through the use of sophisticated analytic platforms. Encompass Health home health patients receive an unparalleled experience that incorporates innovative technology and compassionate care in the comforts of home.
At Encompass Health, we're committed to delivering high-quality, cost-effective care across the post-acute continuum. If you have additional questions about Encompass Health, please contact our Investor Relations Department via our website. Thank you for your interest in our company.